Guess what? We have another
Ask the Doctor
question, and this one comes via social media video. Let's check it out.
I have extremely heavy periods, and I find myself getting really fatigued. Could my period be making me anemic?
Joining us now via Skype to help us answer this question is board-certified OB-GYN Dr. Millie Behera. Doc, welcome back to the show. So is this possible?
Absolutely. Anemia represents when the iron level or your hemoglobin level is too low, and that can happen through two different ways. Either you're not having enough through intake with your diet, or you may be losing too much. And so the signs that we typically look for are pale skin, sometimes shortness of breath, being extremely fatigued, weakness, and sometimes even a higher heart rate. These can all be signs. And particularly when it's associated with that time of the month, there may be that connection that will clue you in that this may be a time to worry.
Dr. Behera, what percentage of women do you think suffer from anemia from heavy periods?
It's extremely common. So first of all, up to 10 to 15% of women have heavy periods. So this is where it's important to know how heavy is too heavy, how much bleeding is too much. And then 20% of those women have anemia. So if women notice that they're bleeding for longer than the typical 3 to 5 days, women that bleed for 7 days, or if you notice passing larger clots or having these signs of anemia, these can all be clues that the bleeding may be too heavy and may not be necessarily within the normal limits. So to look for any underlying causes. And sometimes these are your little red flags for underlying bleeding disorders or anatomic issues that may be curable, like polyps and fibroids. Can be related to hormones as well, and sometimes may even be a clue for some more serious issues like underlying malignancies or cancer cells.
In scenarios like this, Dr. Behera, the women who are losing this much blood every menstrual cycle, they may not realize because they're starting to feel a little bit worse, a little less, but it's just so subtle over time that if you don't actually formally go get it checked by your doctor, you may not realize that you're low in terms of your red blood cell count and your iron levels. Is that fair to say?
Yeah, that's so true. And that's why when you notice a change over time or any of these little signs that you didn't notice before, because only you know when, you're noticing that you're getting tired when you're doing the same things you were doing before, your exercise tolerance is changing. It's a simple test that you could have your doctor do to check your iron level or your hemoglobin level and address these issues early or catch them early on. And then there are simpler treatments.
Can you just walk us through what you do for your patients?
Exactly. So first of all, you want to try to supplement all the natural things in your diet that may have higher iron content in those dark leafy greens, meat if you eat red meat, and also dried fruit, nuts, seeds. Those can all have natural sources of iron. And then there are other issues. If you find an underlying cause of the heavy bleeding, certainly those have specific treatments. And they start as simple as the medications that we use called NSAIDs, which is a family of meds that include your ibuprofen, your Advil. And it's kind of ironic to think that often we think that those are blood thinners, but when it comes to uterine bleeding or period bleeding, it actually can improve the amount of blood loss you see each month. And then there are also treatments such as birth control pills or progesterones. There's another type of medication called tranexamic acids that helps your body clot better and reduce blood flow during the time of the period. These are all sort of simple methods that have fairly low risk that may be able to help control the symptoms so you don't end up losing so much with each cycle.
Dr. Behera.
Yeah, I think that's a big take home. Don't ignore heavy bleeding, heavy periods, because you may be suffering needlessly. Have it worked up and treated.
Absolutely.
Thanks so much, Dr. Behera.